I'm proud today to be joined by so many who are dedicated to combating substance abuse in Wisconsin. So not only today will we have a number of bills as a progression in our multi-year HOPE agenda, but we are also excited to announce that major health insurance companies have already or have now agreed to remove prior authorization requirements for most substance use disorder treatments.
Let's clap for that one.
Agreeing to this partnership are the following groups: United Healthcare, Anthem, WPS, Children's Community Health Plan, Network Health, Quartz, Dean Health Plan, Security Health Plan, and Mercy Health Plan. This will impact over 1 million covered lives across Wisconsin. This is one of the most impactful reforms we have accomplished as part of the HOPE agenda, and we are able to accomplish it most proudly without passing legislation. I believe that's because of the conversations that have been developed and the relationships that have been developed over a multi-year effort here in Wisconsin, rather than having government tell people how to, reform their business, having a one-on-one conversation about what best to serve the citizens of Wisconsin, I believe is the best direction forward for us, and makes me even more excited about today. This is a monumental change that will play a key role in ensuring individuals receive the necessary care to start their journey into long-term recovery. Now healthcare providers can immediately begin a treatment plan in most cases, eliminating an obstacle to treatment for individuals impacted by addiction. I want to emphasize that most cases, and some of my reporter friends might catch on that most. That means not all. There are situations where prior authorization is important and it will continue, such as in the case of other medications that might make it impossible or difficult for medication-assisted treatment, such as in the case of a pregnancy as well. So there are cases where it is appropriate and will continue to be used, but we're talking about all the other situations where this might have been a barrier in the past. This reform, paired with a package of HOPE agenda bills, which are on the floor of the Assembly today, are continued critical components to improving access to treatment for Wisconsinites. I would now like to welcome Dr. Julie Mitchell, Regional Vice President and Senior Clinical Officer of Anthem Incorporated, and Chuck Reinerson, Network Health's Vice President of Health Analytics and Pharmaceutical Benefits, to say a few words.
Hi, good morning. Thank you so much. I do want to start with thanking Representative Nygren for his work on the HOPE agenda and his continued support to increase awareness, eliminate barriers, and propose common sense solutions to this often tricky, emotional, complicated issue. The HOPE agenda has resulted in 30 bills since 2014, thanks to Representative Nygren, and we are proud of that, but there is more work to do. Opioid use affects too many families in Wisconsin. 1 of 6 Wisconsin adults have received an opioid prescription in 2018. Every month, about 75 Wisconsinites die because of opioid use, and about 3,500 Wisconsinites presented to an emergency room or hospital in the past year because of an opioid use problem. So it's for these reasons that Anthem Blue Cross Blue Shield is excited to do this partnership, that we are able to celebrate this agreement today. This agreement, as Representative Nygren has already stated, will increase access and reduce financial barriers for medication-assisted treatments. Anthem has already eliminated those barriers, and if we look back over the last 12 months, we've seen a 30% increase in the number of prescriptions for opioid-based treatment disorder. Because of that and this work, I am hopeful with continued partnership that all members who need this kind of treatment will receive it. And I'll pass it on to my partner at Network Health.
Thank you. And thank you, Representative Nygren and the other members of the legislature who've been instrumental in recognizing and addressing the problem of opioid overuse in Wisconsin. We appreciate your collaborative leadership and embrace the role as health insurers that we play in supporting a broader effort to improve the health and well-being of Wisconsinites. As a Wisconsin-based company serving our communities for more than 35 years, we know firsthand the negative impact that opioids can have on our neighbors, our friends, and our families. It's not a theoretical problem. Addiction is causing real substantial impacts in our communities. That's why for many years, Network Health has covered addiction treatments such as buprenorphine and naltrexone and naloxone without any restrictions on them. Network Health believes in the use of all of these FDA-approved medication treatments along with providers who are trained to provide a whole patient approach to the treatment of substance use disorders. As a pharmacist, I know the impact that unnecessary prior authorization can have on delaying treatment, and we want to get these medications to people as quickly as they can. Delaying access to medication-assisted treatments can really be devastating for the person who's ready to begin this therapy and move forward to improving their life. We support federal and state statutes along with regulations that ensure providers are trained in appropriately prescribing opioid treatment plans. And we trust our providers to prescribe the appropriate course of treatment. Once that prescription decision has been made, we want to make sure people can get those medications as quickly as possible, which is why we support this legislation, this effort. In partnership with key stakeholders, Representative Nygren and other members of the legislature and our regulatory agencies, we want to work with them to continue to diligently solve the problems of opioid addiction in Wisconsin. At Network Health, we want to be a part of that solution, and swift access to addiction medications demonstrates that not only to policymakers, but also to all of our communities and our members that we all know. That's our pledge as our neighbor, as a local health plan. It's our hometown advantage that we want to help the people in this community and communities across this state to have this access. So we're happy to support this, so thank you. I'd like to introduce Kevin Roy, Chief Public Policy Officer for Shatterproof.
Great. Thank you very much. Good morning. Again, Kevin Roy, I'm the Chief Policy Officer for Shatterproof. Shatterproof is a national nonprofit dedicated to reversing the addiction crisis in the United States. And I also want to thank Representative Nygren for his great leadership on the HOPE agenda and his colleagues that are here from the legislature that have also been leading on this issue for a long time. And also want to thank the members of the Alliance for Health Insurers in Wisconsin and the Wisconsin Association of Health Plans, and for those that they are represented by as part of this announcement. Decades of research shows that when you improve access to medication for addiction treatment, that it saves lives. One study showed annual reduction of 30% in heroin-related mortality based on the introduction or improved access of MAT in states. So we know that it saves lives. We also know that it reduces healthcare costs as compared to patients without medication. And so that's a significant factor here as well, and a reason that you're seeing such a desire to expand access to it. And in terms of total healthcare costs, that's even when factoring in the cost of the medications themselves, the savings can be significant. A multi-state study also observed that for youths, that retention was significantly increased when they had better access to MAT as compared to just having behavioral health services. And so greater than 40%, depending on the particular type of medication they used, better retention. And so that's really a really critical factor to improving outcomes for everyone involved. And so we know that this agreement today is going to save lives in Wisconsin. I mean, that's something we can say, and I think that's a really, as Representative Nygren said, it's a big announcement, and we're really grateful as advocates in this arena to see Wisconsin being one of the leaders here and trying to expedite access to treatment for those that need it. And we hope that other states will follow the lead in terms of improving access to evidence-based treatment. So with that, it's my pleasure to introduce Skye Bauman, from Safe Communities.
Good morning, everyone. I am a person in long-term recovery, and I am here to talk just about kind of the human face of this. In 2017, which is the last year that we have national data for, we lost over 70,000 people to overdose. In that same year, 11 of those people were people that I knew and I loved. Today is a good day because the people that I love that are still trying to make their way into the recovery community have a 60% greater chance of making it there alive because of this agreement. So today is a good day for the recovery community. People have a 50% less chance of relapse when they are able to take medications for opioid use disorder, and they're better engaged in treatment. The outcomes are there, the research is there, and with this additional access, lives will be saved. It is my pleasure to welcome Cynthia Valentin, the Vice President of Therapy Services at Aurora Behavioral Health, up next.
Good morning. Yes, I'm Dr. Cynthia Valentin from Advocate Aurora Healthcare, and I'm the Vice President of Behavioral Therapy Services. So I'm going to echo what our previous speakers have spoke to and applauding the efforts that have made to make a monumental change in our ability to access the services and specifically MAT services for our patients. Today is a good day. It's a monumental day, and so many of our practitioners will sit and be smiling at thinking that the time that they had previously needed to take, meaning anywhere from 72 hours to 2 weeks in order to get an authorization or pre-authorization for the bupropion, or up to 30 days for Sublocade, is now being removed. We are in the face of our patients coming to us who make daily choices that they are choosing to enter into the road of recovery. And when they were faced with, yes, we want to be there and help you, but we've got some little barriers, meaning time delay in order to get you what you actually need. And in those moments and in their pain, oftentimes the decision is immediately changed to returning to their drugs of choice because the pains of their addiction has overwhelmed that moment. And to the unfortunate outcome for many who have just heard end up losing their lives to their addictions and through overdose. So today you have offered us the opportunity now to have access, immediate access to many of the substance use disorder treatments that we so welcome. We are able now to engage in flexible prescribing, and those who had received previous prior authorizations will now not have to wait when they're already fully engaged in treatment for yet another prior authorization. We welcome all of the partnerships that have happened. Representative Nygren, we thank you from the bottoms of all of our hearts. We appreciate everything that's being done, and without a doubt, to the families and to the patients, most importantly, they now have an opportunity for that new door and hope to their own recovery. So on behalf of all of my team members at Advocate Aurora, we thank you. And we thank you for now the ability that we can focus on treatment and not spend our hours in paperwork and chasing potential outcomes. Wisconsin is a national leader and been recognized as a national leader in their efforts to combat the opioid and other substance use disorders. And today's announcement is a prime example of our state's leadership's commitment to continue this recovery. And on that, I thank you. And now I'm pleased to introduce Dr. Mike McNett and Dr. Galbus Reese.
Thank you, Dr. Valentin. I'm Mike McNett, and I'm here on behalf of the Wisconsin Medical Society. I'm chair of their opioid task force, and I want to express our support for the elimination of prior authorization for medications for addiction treatment. We appreciate the vision and leadership that Representative Nygren has shown in tackling this crisis throughout all of its branches, and now really focusing on the addiction component. And he has not only brought together the partnership before you, but he has brought together the entire HOPE package, which has been a comprehensive approach. These initiatives have really helped make Wisconsin a leader in the country in fighting addiction. Physicians are tasked with requirements and regulations that can serve as an impediment to patient care. By removing barriers to treatment, like prior authorization for medication-assisted treatment, we are improving the physician-patient relationship and improving our patients' outcomes. Now I want to turn it over to Dr. Galbus Reach, who works with me on the task force and is also head of the Wisconsin Society of Addiction Medicine.
I am the current president of the Wisconsin Society of Addiction Medicine, as Dr. McNett said. Medication-assisted treatment, or medications for addiction treatment, which is a new terminology, is an evidence-based treatment that helps patients with opiate use disorder achieve and maintain sobriety, a healthy life, and productive life. As physicians, we need all of the tools available to us to treat our patients. It has been my experience that any delay in treatment that exceeds the window of sobriety could cause an addicted patient to relapse. And Representative Nygren's proposal to eliminate prior authorizations for medications for addiction treatment addresses that problem. We applaud the removal of prior authorization for medications for addiction treatment and look forward to continued partnerships with the legislators, insurers, and health systems as we all continue to fight the opiate crisis. And now I will turn it over again to Representative Nygren.
This is not a conversation that happened overnight. This has been an ongoing conversation for multiple years. Actually, this effort was actually changed through the Medicaid program. Prior auth was removed about 2 years ago under a previous administration. So, I mean, just kind of shows you that this has been a work in progress to get us here. But from the beginning, the different advocates, the different coalition members that are up here before you have been receptive, and we met with open ears. And as a matter of fact, I'd like to add, we added a late-minute member to this partnership, and that'd be Navitas as well, is joining us here today. So I appreciate their contribution. But this is something I just want to say thank you to all my colleagues that are joining me here today, and the ones that couldn't be here today, because up to this point there's been 30 pieces of legislation, all but one passed unanimously, and the one that didn't had one no vote in both houses. So that's not Republicans, Democrats pushing this. This is actually everybody coming together and saying this is the right thing to do for Wisconsin. And in this effort, specific dealing with prior authorization, in many states, this has been led by the administration. But Wisconsin's different. We're leading it through the legislature. And that's something that makes me proud to continue to work in this building every single day, that we have people willing to, perhaps maybe go out of their normal comfort zone to work on an issue that can be painful. And it can be very humanizing. And I'm very proud of my colleagues for listening and being supportive over the last several sessions. In closing, I want to extend my sincere thank you to everyone involved in making today possible. Hundreds of bills are passed each session, the majority of which it's very difficult to see an impact. Large amounts of the public, impacts to the large amount of the public in a substantial way. But today is different. This agreement will impact lives. It will save lives, as mentioned by others. And that's something for all of us to be excited about. As we started this conversation today, this is a good day for Wisconsin. It's a good day for the people who need our help. And because of this decision, they're going to get it. And it's going to make a difference in so many lives. So with that, thank you again for everyone for being here. And I'd be happy to open up for a few questions.